Hello and welcome to week 5. This week, we're talking about money. And money makes the world go round. Seriously, though, we're talking about reimbursement. And remember, medical coding specialists have their hand on the revenue tap of the money that is coming into the facility, whether it's a single physician office or a big mega hospital. The fact is that what coding specialists do and billing specialists do is what brings the revenue, the money into the facility based on what they legitimately earned, which is, of course, what you want, right? However, if the medical coding specialist or billing specialist does not do a proper job, that will thwart the reimbursement from coming into the facility, which means problems with payroll, problems with bonuses or raises, not to mention problems with equipment and updates and supplies and all the things that you need to do your job. Worse, and I hate this part, worse is there are some facilities when the coding specialist has messed up and the claim gets denied, they don't investigate this to find out, oh, it was a coding error. Instead, they just send the bill to the patient and make the patient pay it. And that can cause a whole lot of cascade of debt and misery for the patient then, because they're ultimately responsible for paying a bill that the insurance company would have paid if the medical coding specialist and billing specialist would have done their job correctly. So this is why this is such a critical job. So let's take a look at the elements of the reimbursement part of this process. First, I know there are some confusions. You probably heard the term third-party payer. And that is the umbrella term that we use in order to establish each person's role in the reimbursement process. So first we have the physician or the healthcare provider who is providing knowledge and skill. Second, we have the patient who needs that knowledge and skill and those services. But it's not either one of these first two people that are paying the bill, it's the third party who's going to pay, ergo the third party payer. Now, we use that umbrella term because it's not always an insurance company that is taking on that role to pay for those services being provided to that patient. Sometimes it's a government agency like Medicare, Medicaid, or Tricare. And that may seem weird to you, but technically, Medicare, Medicaid, and Tricare are not health insurance carriers. So that's why we have to use the generic term. Now, I do want to make a note in that there are some sources that I have run across that puts the patient first and then the healthcare provider first, second, second, first. Okay, what I want to tell you is that's really not the point. The point is, how do we get to third party payer? And that's because there have to be these other two people first, right? Okay, so third party payer are people who are not involved intimately in the provision or receipt of healthcare services, but they are paying the bill. Okay. All right. So let's talk about a couple of different types of healthcare insurance policies and plans. All right. The first is an HMO, and I'm sure you've heard that before, Health Maintenance Organization. And this is a health policy that uses a primary care physician, PCP, primary care physician, as a gatekeeper. In other words, this is the person who is in charge. This is the coordinator. So the primary care physician is the one who says to the patient, I can help you, okay? Or you need a specialist, I will give you a referral to somebody with more knowledge in that specific area or anatomical site, okay? And so that way you have one person who is skilled and knowledgeable in healthcare making the decisions. And the point of this, and you hear that HMOs save money and the cost of healthcare. And the reason for that is going to a specialist is more expensive per hour, per encounter, per time, whatever, okay? It costs more money. But what if the patient only thinks they need a specialist, but the primary care physician is perfectly capable of doing it, caring for it? That's where the money is saved. Okay? Does that make sense? All right. A preferred provider organization gives the patient or the beneficiary more freedom for them to decide, I decide I want to see an allergist. Okay, I'm sneezing, my nose is stuffed. I want to go. I'm going to go see an allergist, and they go right to the allergist instead of going to their primary care physician first. And the PPO will still pay it as long as it's within network, and the PPO will also pay if the beneficiary goes to get care from a healthcare provider who is not part of this network. They just pay less, and the patient or the beneficiary pays more. Okay. Now, this is very good, can be very good for someone who already has a relationship with a specialist. For example, someone who has diabetes may already have an endocrinologist who they really, 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 really like and have a relationship with. But when they join this PPO, that endocrinologist is not a part of that network. This gives them the freedom and still some financial support to continue seeing that endocrinologist. Okay, so it gives the patient more decision-making power. Now, of course, if you get, you got to give, right? So what does that mean? PPOs tend to be more expensive with regard to the monthly premium. And of course, the copays may be higher. It all depends on the particular plan, okay? But generally speaking, a PPO is going to have a higher premium than an HMO, okay? Good, all right. Don't forget, you can always email me when you have questions. The email is on the last slide. So then we have a point of purchase, not marketing. This is healthcare. Okay, a point of service plan, which allows an HMO enrollee or somebody who has and is covered by an HMO plan to choose a non-member physician at a lower benefit rate. Okay, so basically this is the hybrid of an HMO and a PPO. Okay, all right. Then we have the Centers for Medicare and Medicaid Services. As I mentioned before, this is an agency of the United States federal government. These are programs. They are not insurance policies. But when it comes to healthcare, they function very similarly. In other words, you go to a participating healthcare provider, they will send the claim, and the agency, Medicare or Medicaid, will send the money, the reimbursement. Okay. Now, one thing that people get confused about is the difference between Medicare and Medicaid. And of course, as professional coding specialists, you must pay attention to detail. This is so incredibly important. So I came up with this little way to help you remember which is which. So Medicare with the RE at the end, think retired people, which is Medicare covers people who are 65 and older. Medicare also covers people with end-stage renal disease or any permanent disability, for example, blindness. Okay? That is what Medicare does. That's who Medicare pays for healthcare services. That's what you need to be eligible for Medicare. Okay? All right. Now, Medicaid, ID at the end, think indigent, which essentially means a low-income individual. So Medicaid is available to people who are eligible, who are making a certain percentage of the official federal poverty level income. Okay? And again, these are agencies of the federal government that pay for healthcare services from healthcare providers, number one. Two, eligible patients, number two, and they pay for it, so they are third-party payers. Okay? All right, Tricare. Tricare is also a government agency. It's within the Veterans Administration, and it pays for, it is the third-party payer for medical expenses for the dependents of active duty service members. Okay, so we have an active duty service member, they have children who are their dependents. So the children's health care can be covered under or paid for under Tricare. Okay. There are also eligible retirees, those who have retired from the military. They put in their 20, 30 years. I'm sorry, I don't remember specifically. And their families, as well as the dependents of those who were killed in action. Okay, so if you have a parent and children, and the other parent was in the military and sadly killed, that at-home parent and the children would be eligible for healthcare services to be paid for by Tricare. Okay? All right. Also, active duty service members, known as sponsors, the dependents, spouses and children, surviving spouses and surviving children of deceased active service members, retired service members, their spouses and their children, and surviving spouses and children of deceased retired members. So chances are, if you or someone in your immediate family is involved in the military, chances are they should be maybe eligible for healthcare services to be paid for, third-party payer, under Tricare. Okay? All right. There are other types of health insurance or insurance that pays for health services that you should be familiar with. Workers' compensation. This is separate from your regular healthcare plan or your regular health insurance. Is workers' compensation is an insurance program that covers healthcare services for individuals who are injured or become ill as a direct consequence of their employment. Okay? So an individual is climbing a ladder in their workplace at their office, and they fall off the ladder. That's workers' comp. That's not that individual's health insurance. Okay? Disability compensation, a separate plan that will reimburse an individual a portion of his or her income that is lost as a result of being unable to work due to illness or injury. And probably the one you're most familiar with is Aflac. Aflac. Is that a goose? I think it's a goose. But anyway, Aflac is a company that specializes in disability compensation. And that's why they say money when you're hurt and can't work to pay the other bills. Because we remember that health insurance, whether it's an HMO, a PPO, workers' compensation, or other that we'll talk about in a minute, puts an individual in a position where they cannot go to work, then that's fine. Okay, so the healthcare, the doctor's bills, the medication prescriptions, all of that is paid for. But if you're not going to work, you may not be getting paid. And if you're not getting paid, who's going to pay the rent or the mortgage and the electricity and the Netflix bill? Because if you're sitting at home, you definitely need Netflix to, although I'm more of an Amazon Prime girl, but you know what I'm saying. Okay, so disability compensation when you're out of work due to health or injury, this is a policy that will give you the money to pay those other things, rent, electric, food, etc. Okay. Liability insurance is a policy that covers loss or injury to a third party caused by the insured or something belonging to the insured. So the best example I can give you of liability insurance is, oh, this may be a little old-fashioned, but do you remember shopping malls? You know, where you go to this big, huge building that has like 400 stores in it? Okay. So you go to this shopping mall, big, huge building, and you're coming down the escalator and the escalator jams and you fall forward and get hurt. Okay. That doctor's bill, hospital bill, ambulance bill is not going to get paid by your regular health insurance. It's going to be paid by the liability insurance carrier of the shopping mall, the owner of the shopping mall. Okay. Or, for example, the liability portion of homeowners insurance. So let's say you are at your house and you're climbing a ladder to change a light bulb in a high ceiling, and you fall off that ladder and get hurt in your own house. That is going to be covered by your regular health insurance company. Okay. But let's say you're a really, really, really nice person and you go next door to where the little old lady and the little old man live, and you're climbing a ladder in their house and you're to change a light bulb way high up and you fall off and get hurt. The liability portion of their homeowners insurance will pay for your hospital bill and your ambulance, etc. Is that a little complicated? Okay. And then last but not least, auto accident liability insurance will often pay for medical bills, lost wages, disability. Okay. It's like a combo platter for someone injured by the insured in an auto accident. Okay. That is going to depend on, but if you look at your auto insurance, very often it's like 100 is pay your medical bills under your own policy. And then you have a part of that insurance that pays medical bills for anyone hurt in or by your car. Okay. Okay. All right. So your assignment this week, chapter 7 and chapter 8. You'll notice chapter 7 is about inpatient payment services and chapter 8 is outpatient. Just as a review, being admitted into a hospital, having a room, okay, staying overnight, inpatient. Outpatient is everywhere where they don't really give you a bed to sleep in. Okay, that's the briefest. But by now, you know the difference between inpatient and outpatient, right? Right. If you want a better description or understanding, email me. All right. And of course, keep reading through your CIC medical coding training certificate, certified inpatient coder study guide, because we're working toward that test. That's going to be beautiful to have on your resume. All right. And then you have a quiz on what you read, because that's the way we work in school, to make sure that we can confirm your knowledge. Okay. And then you're going to do your analysis. And really, when you're doing this analysis, again, do not just say, oh, yes, the correct answer is correct. You need to investigate. What word did you misunderstand in the question? Or what word did you skip over? Did you not read more carefully enough? This is a habit you need to develop. So if you're getting answers wrong because you're not reading carefully, that's a wake-up call. I'm just saying. Okay. You have information in your inpatient PPS and hospital outpatient handouts added into your course room. And also pull out your Lex Coded textbook and review chapter 39. Good idea. Email me. I'm here 7 days a week, and I am eager to help you succeed. That's just the way I rock. Okay?